Hello, my name is Ana Laura Espinosa Garza, and today I will be discussing health inequity in the United States as a systematic review of the limitations of the Latino community in accessing health services. First, I would like to discuss the events that inspired my interest in this topic. The medical hardships that my own family has encountered and its need to rely on health insurance to pay life-saving surgeries, medications, and constant procedures that ensure the physical well-being of different family members has made me realize the crucial role that qualitable healthcare places on a person's life. Seeing the constant reports of the negative disproportionate effects that racial and ethnic minorities face in the COVID-19 pandemic made me want to research how people with a similar ethnic background had to experience the US healthcare system. Hence, the spark of the research question of how do legislative and socioeconomic differences from other US residents impact Latinos' access to health resources in the United States in the 21st century. In this presentation, I will be addressing the different methods used to select the sources used, the two themes identified, the trends and gaps in these resources, and finally, the limitations of this research paper and my recommendations. Now, it is imperative to acknowledge the relevancy of the eradication of healthcare disparities, as they would eliminate the inequalities by health status and further prevent and manage public health outbreaks similar to the global pandemic that is COVID-19, which explains why the Global Health Organization established in its 1946 Constitution that each individual has the fundamental human right to the highest attainable standard of health, defining this concept by encompassing physical, mental, and social well-being. Moreover, the Agency of Healthcare Research and Quality claims that individuals need four components to assure that they are obtaining efficient health services. They have an opportunity for insurance coverage, a usual source of care, access when their need is recognized, and a need to be treated by capable, qualified, culturally component providers. The United States healthcare system is the most expensive and arguably the least cost-effective compared to other developed nations. Both in function and in structure, economic forces continue to drive the United States healthcare system, which directly leads to the disproportionate detrimental effects of those in vulnerable positions, notoriously racial and ethnic minorities. With the need to ensure healthcare access for all, individuals' cultural identity is a significant determinant for receiving adequate healthcare. By 2020, the Latino community is now the largest minority in the United States. Latino is the shorthanded version of the Spanish word Latinoamericano, referencing people born in or with ancestors from Mexico, Central, and South America. A report demonstrates that Latinos make almost 20% of the US population, taking into account only documented people, which makes it imperative to assess the systematic and social limitations that impact how healthcare is distributed to this group, not just for humane reasons, but to have a healthy workforce. A systematic analysis of sources was carried out to understand health inequity for Latinos in the United States, which focuses on the thematic evaluations of various sources that evaluate the legislative restraints, financial barriers, and socioeconomic obstacles when Latinos access health services in the United States. From Google Scholar, JSTOR, and EBSCO's Explora Secondary School portal, relevant articles were acquired and screened. From these, some were excluded for lacking relevancy with the topic, their publication date, a language other than English, and for lacking any discussions or solutions. Next, the sources were assessed by reading and highlighting the most relevant details. The sources were assessed by applying the CRAAP test, and the results were recorded in a spreadsheet. Additionally, the author's backgrounds, methods, and sources, the publication source, and the conclusions and discussions were placed on a Google document to access the connections between these media. Finally, 24 sources were selected, which included peer-reviewed journals, renowned academic book publications, and websites from national institutions, making all of the sources in the synthesis reliable and credible. Within the Latino community, there are various groups that are in the most vulnerable positions. That include undocumented immigrants, those who lack a stable income source, and those who face a persistent language barrier. But studies agree that one of the most vulnerable populations continues to be undocumented individuals, as their legal status presents a unique challenge when accessing healthcare in the United States. This lack of legal status suggests that a fear when seeking medical services, as most assume that their documentation status will be informed to authorities by healthcare professionals. PhD graduate Stephen Wallace and his colleagues from the University of California in Los Angeles conducted 4 focus groups of uninsured Mexican immigrants and concluded that the most significant problems lay with health insurance, precisely that of employer-provided health insurance. Thus, the need to expand community health centers as immigrants already obtain services from these spaces without the fear of being about their legal status. A peer-reviewed article published by the American Sociology Association suggested that parental legal status significantly influences the youth's mental health matters. Currently, the health policies in place have brought contradictory results to the accessibility of medical services to the Latino community. Nonetheless, there exists a turning point for healthcare access that results in significant impacts for the Latino community, which is the Affordable Care Act. The ACA is a turning point for the accessibility of healthcare access to a Latino community by increasing the beforehand persistent statistics of physician visits and health insurance. However, four policy dilemmas relevant to Latinos health services and the ACA have been identified. To be effective, authors agree that the ACA needs to extend coverage to undocumented immigrants, acknowledge Latinos population growth in states with limited insurance expansion, and to understand the demands of the public and private systems of care, and to increase the Latino healthcare workers. Studies support that policy action beyond the ACA implementation is needed to encompass those excluded from coverage options notably. In an influential report, authors reported how Latinos face reduced appropriate access to medical care by financial, structural, and institutional barriers. Associate Professor Leham from the Institute for Latino Studies in the University of Notre Dame asserted that imperative to consider the social determinants within the healthcare system and to restructure the financial distribution to have a larger focus on physicians that have direct patient relationships. Latinos tend to be employed in less stable jobs with less pay and are less likely to possess health insurance, which is why researchers assert as secondary barriers to healthcare. The difficulty of getting appointments, the lack of after hour medical services, or the long waiting time for medical specialists is a product of the economic obstacles that this community faces with the structural challenges within healthcare. The demographic patterns of Latinos in the United States have also given a rise to health disparities. The evident socioeconomic struggles and limitations of availability of health services in these communities represents the need to consider the social and economic factors of Latinos for an equitable health system. Still, other social behaviors and cultural factors also play a crucial role when accessing medical services. The healthcare system has demonstrated to have a limiting availability of resources to Spanish speakers with a limited English proficiency, as there is a need for these institutions to adapt and to have a more inclusive personnel and availability of bilingual materials. Continuously, a research-based community partnership from 2007 to 2009 reported that 82% reported that cost of care was the most significant barrier to accessing health services, along with language fluency and the fear of discrimination. Finally, many respondents felt that family and faith could help them when in the need of health services, as they viewed that the United States healthcare system was a luxury that could not be afforded. All in all, one of the most notable legal factors that must be considered to ensure the accessibility of healthcare is Latinos' documentation status. As documentation immigrants are hindered the most within this community. They are disproportionately affected by the lack of health insurance, which is considered the most critical limitant of medical services for this ethnic group. Nonetheless, a recent turning point has been the ACA, as it has demonstrated positive statistical changes in health insurance numbers and physician visits for Latinos. Contributing to this health disparity, there are also social and systematic barriers for Latinos. There is an inadequate financial distribution compared to other U.S. residents that act as a primary barrier for the healthcare system. Also, the lack of inclusion of social and cultural determinants is also influencing their health disparities. Furthermore, the lack of Latino healthcare providers reduces the trustworthiness Latinos have within the healthcare industry. Among studies, the most effective way of improving access to healthcare for those Latinos in a more vulnerable position is to consider that further research is necessary to qualify the importance of documentation status under access to health services. Health insurance importance as the most influential barrier between Latinos and healthcare access is also a point of discussion among authors. In all sources, the need to improve healthcare policy and create a more culturally sensitive environment was a persistent solution. Most media included either a community engaged study by authors or an analysis of a survey of pre-collected data that the same organization did. This methodology can lead to an error analysis or misinterpretation of the results. Another limitation to the proposed solution of these barriers include that health policy and the restructuring of the healthcare system would require multidisciplinary action within the political, scientific, academic, and public sectors. This collaboration among fields will require clear communication methods that are worth developing to ensure health equity among all United States residents. For future research, authors must focus on how health policies will be communicated to a Latino community. Additionally, overcoming the language barrier faced by millions is essential in the success of equal and fair health access. Another critical source of progress is the inclusion of Latino healthcare workers into a labor force. Lastly, a multidisciplinary approach must be taken to educate both workers and patients to improve efficacy, communication, and provide a better care for those in the need of it. Thank you. If there are any questions, it's open now for questions.
All right, wonderful. Thank you, Anna. Do we have any questions? I guess my question would be, and I'm not sure that you touched on it, but whether or not there'd been any specific impacts from COVIDs that were maybe uniquely impacting the Latino community in the United States.
I didn't discuss them further, but as I mentioned in the beginning of the presentation, there have been various studies that have been focusing especially on ethnic and racial minorities, specifically that of the Latino community. And one of the most persistent results was that the language barrier was being especially highlighted right now during the COVID-19 pandemic, as it has been really one of the most important restrictions to accessing healthcare of this ethnic group because they couldn't really communicate many of the symptoms that they were having. So by the time the physician noted the symptoms and actually ran the COVID-19 test, they wouldn't have already taken the precautions and the safety measures needed. So that was mainly one of the things that many studies agreed on.
Okay, thank you. Any other questions? Paul.
I thought it was such an insightful point about the language. I don't know if this is actually really a question, more just like a great statement. It's such an insightful point about the language, though, because a lot of the vaccine delivery issues have not been going towards the Latino community, mostly because like it's advertised without the correct language about when the dosage is and where to get it. And then the systems are often put towards people who are on like an English website that's not translated, and this, so if someone can't read it, they have difficulties. Maybe a question would be like, what are some maybe small initiatives that could be done to get that access or educate or basically any of the topics you talked about today?
Yeah,
like, what are some actions?
within one of the most current solutions that is being implemented is the community center healthcare facilities, since these community centers are one of the top places where Latinos can see Latinos healthcare workers, which is really important since it can inspire that sense of trustworthiness, especially for undocumented individuals. And these community centers are actually the ones that are the most in charge of informing the public, well, the Latino public, of the COVID-19 vaccine and everything going on. So the expansion of these community centers was one of the most noted discussions on the most recent papers that addressed the situation right now.
All right, thank you so much, and thank you for the questions. So